In addition to our previous topic discussion on pipetting exercise, I am presenting you now an additional pre-recorded video presentation to facilitate or to help you visualize better the pipetting steps that we are referring from. So basically, this is an example of an automatic pipette, an air displacement automatic pipette. So let us begin by introducing you with the basic parts of an automatic pipette. This is an air displacement pipette. So we have first is the push button. It is used to dispense or aspirate liquid samples, liquid solutions, or reagents. Next one, we have the tip ejector button. So you can see here that there is an extension structure coming from the tip ejector button. This is a mechanical portion of the tip ejector button, which is functionally used for ejecting the pipette tip. So for example, upon pushing down the tip ejector button, see what will happen to the pipette tip. It will be ejected. So that is the function of the tip ejector button. So next basic part is the volumeter display. So this portion will display the amount or the required volume that you are going to aspirate. So next one, we have the serial number. This serial number is only intended for inventory purposes. Next one, we have the volume adjustment ring, or called as the Thumbwheel. It is used for volume transitioning. For example, I will change the volume to 60 or 600 microliters. So as you can see, the transitioning was made using the Thumbwheel or volume adjustment ring. So now I am going to show you or demonstrate to you the different steps involved in pipetting. So we have the preparation, aspiration, distribution, purge, and the home or resting position. So look at the pipette push button. This is the resting position or the home position. If you press it downward, that is the first stop, and then push it again, that is the second stop. So technically, or actually, when you are using an automatic pipette, you can actually hear and feel the sensation that you are already hitting the first or the second stop. So let's begin by of course setting the desired or the required volume. Let us assume 500 microliters, and then from the rest position, you press the button until you reach the first stop. After you reach the first stop, you must release to aspirate. So release it slowly. You have to make sure that the pipette tip is immersed in the liquid surface. When the plunger is released, you will see that you have already aspirated the fluid or the liquid solution or the reagent, and you have to make sure that you waited for 1 second so that all the liquid has time to move up into your pipette tip. On the distribution step, you have to depress the plunger to the first stop position to distribute the volume. And then, after putting the tip into an angle, actually 10 to 45 degrees angle, depress the plunger up until the second stop. So ipupush mo siya pa once. When you release all the volume that you have aspirated, slowly allow the plunger to move up to the rest position again. Okay, this time I'm going to show you the step-by-step procedure in aspirating liquid solutions or reagents. So the first thing you have to do is to, of course, set the volume required or desired, and then position your pipette vertically onto the glass tube containing the liquid solution, and then home position first of the push button, push until the first stop. Okay, and then on the aspiration, make sure that our pipette tip is immersed in the liquid surface, and then release, allowing the push button going back to the resting position. Now, in the distribution, after releasing, distribute the liquid you have aspirated. Position your pipette tip on the side wall of the glass tube. or the vessel, receiving vessel. Okay, next is the purge. Push the button until the second step to release all the liquid. So, second step immediately. And then go back to the resting position. That is how you use or how you aspirate liquid solutions using a pipette, automatic pipette.